Assalamualaikum warahmatullahi wabarakatuh. I would like to say thank you for coming to my presentation. It's great to see you all. Okay, let me introduce myself. My name is Selika Prahayu, and then I student from the Muhammadiyah Institute of Health, Science and Technology, Palembang. Well, here I will present about preliminary report of typhoid fever. And then number one definition, typhoid fever or enteric fever is an acute infection disease that usually hits the digestive tract with symptoms of fever for more than 1 week. Indication and mental disorders. Typhoid fever is caused by Salmonella typhi infection. And then number two, etiology. The main cause of typhoid fever is the bacterium Salmonella typhi. Salmonella typhi bacteria are gram-negative bacilli, move with vibrating hair, do not pora, and have their types of antigens, namely O antigens, H antigens, and antigens 7. Other trigger factors are the environment, low immune system, feces, urine, contaminated food or drink, and then formalities, and so on. And then anatomy of physiology. The arrangement of the digestive tract consists of oris, pharynx, esophagus, ventriculus, minor intestinum, intestinum major, rectum, and anus. In the case of typhoid fever, Salmonella typhi multiplies in the small intestine. A. Small intestine, intestine 12 fingers, empty intestine, intestinal absorption, and then colon, and then rectum and anus. And then number 5, pathophysiology, the process of the course of germ disease enters the mouth, throat, food, and drink, contaminated by Salmonella. Some germs can be destroyed by stomach HCl acid, and some enter the small intestine. Lymphoid tissues of Peyer's, Plaque's, and mesenteric lymph nodes undergo hyperplasia. The bacil enters the bloodstream through the thoracic duct and spreads throughout the body's endothelial reticulum organs, especially the liver, bone marrow, and lymph through the portal circulation of the intestines. Gastrointestinal bleeding occurs due to erosion of blood vessels around the plaque that is undergoing necrosis and hyperplasia. This pathological process can take place up to the muscular, serous intestinal, and result in perforation. While the transmission of Salmonella typhi can be transmitted through various ways known as 5F, namely food, fingers, vomitus, fly, and throat feces. And then number 6, clinical manifestation. High fever of approximately 1 week accompanied by severe headaches and digestive tract disorders. Some even experience impaired consciousness. High fever usually starts in the afternoon until the evening. Then it goes down in the morning. This fever lasts for approximately 7 days. Indigestion that occurs in patients with typhoid fever, nausea, vomiting, heartburn, flatulence, anorexia, typoid dengue, and in addition, it can also cause diarrhea and constipation. Impaired consciousness can also occur in typhoid fever patients, namely apathy and somnolence. In the second week, there can be hepatomegaly, splenomegaly, and roseola. Roseola is a small reddish spot on the abdomen, chest, and sometimes buttocks. And then number 7, complication. Number 1, intestinal complication, intestinal bleeding, intestinal purpose, and paralytic ileus. Number 2, extraintestinal complication, cardiovascular complication, blood complication, lung complication, complication of liver and gallbladder, kidney complication, complication of the bones, neuropsychiatric complication. Then number 8, supporting examination. Number 1, leukocyte examination. In some literature, it is thought that typhoid fever has leukopenia and lymphocytosis relief, but in fact leukopenia is not often found. Number 2, SGOT and SGVT check. Number 3, blood breathing. Number 4, culture. Urine culture can be positive in the first week. Urine cultures can be positive at the end of the second week, and facial cultures can be positive in the second week to the third week. Number 5, anti-salmonella TB (EGM). This examination is done to detect early acute Salmonella TB infection because EGM antibodies appear on the 3 and 4th day of fever. And then number 9, management. Number 1, treatment. The client is reset 7 days to 14 days to prevent complication of intestinal bleeding. Number 2, gradual mobilization when there is no head in accordance with the recovery of transfusion if there are bleeding complications. Number 2, diet. Appropriate diet, calories, and high in protein. In acute patients can be given filter porridge. After being fever-free, given a coarse porridge for 2 days. Then the trim rice continued with regular rice after the patient is free from fever for 7 days. Number 3, drugs. Chloramphenicol, amoxicillin, cotrimoxazole. And then number 10, assessment. Assessments, number 1, identification. Number 2, main complaints. Number 3, laboratory examination. Number 4, physical examination. Then number 11, nursing diagnosis. Number 1, hyperthermia is associated with the disease process. Number 2, acute pain is associated with physiological harm agent. Number 3, nutritional deficits are associated with the inability to absorb nutrients. And then number 4, constipation is associated with insufficiency of fluid intake. Number 5, anxiety related to separation with parents, unfamiliar environment, procedure of action. Number 6, the risk of lack of fluid volume is associated with inadequate intake and increase in body temperature. And then intervention. Diagnosis hyperthermia is related to the disease process characteristic, goals and criteria of result, nursing outcome classification result criteria, body temperature in the normal range between uh, 36.5 until 37.5 degrees Celsius. Pulse and breathing within the normal range. There is no change in skin color and no dizziness. And then intervention. Review skin color. Monitor body temperature at least every 2 hours. And TG and LR monitors. Then TV decrease in the level of consciousness and then increase feed and nutrient intake, give a warm compress on the surrounding axilla and thin folds, give clothes that are thin and absorb sweat and collaboration of giving antipyretic uh, coag. Thank you for your listening. May all those we have shared be beneficial for all of you.